हेलो गाइस। आज हम रिकॉल करेंगे डर्मेटोलॉजी एम्स 2020। क्वेश्चन नंबर 1। ए मेल पेशेंट विद a history of fever and joint and back pain develops hyperpigmentation over the nose after 5 days of taking NSAIDs. Diagnosis: A. Melanoma, B. Fixed drug eruption, C. Dengue, D. Chikungunya. इसका करेक्ट आंसर है डी, चिकनगुनिया। Chikungunya, the given clinical scenario with centrofacial pigmentation involving the nose with history of fever, joint and back pain is suggestive of chikungunya. Chick sign. Question number 2. Methyl isothiazolidinone used in cosmetic as A. Surfactant, B. Humectant, C. Preservative, D. Emulsifier. इसका आंसर है C. Preservative. Preservative. Methyl isothiazolinone is a preservative. MI was initially used occupationally in paints, adhesives, or glues and cleaners as a mixture with methylchloroisothiazolinone (MCI). Since 2005, it has been widely used in cosmetics and household products such as moist wipes, shampoos, cleaners, and liquid laundry products. When used in the industrial setting, MI was thought not to be a significant occupational allergen. Subsequently, following extensive domestic use, MI was found to be a strong allergen. It was responsible for an epidemic of contact allergic dermatitis 2016. MI was named Contact Allergen of the Year in 2013 by the American Contact Dermatitis Society. Question number 3. A young female came with a complaint of a bizarrely shaped lesion over her face as shown in the image. Diagnosis: A. Contact dermatitis with henna, B. Dermatitis artifacta, C. Vitiligo, D. Insect bite. इसका आंसर है बी, dermatitis artifacta. Dermatitis artifacta, the given clinical scenario is suggestive of dermatitis artifacta, also known as factitial dermatitis. It is a condition in which skin lesions are solely produced or inflicted by the patient's own actions. The lesions that are difficult to recognize and do not conform to those of known dermatosis risk factors. Underlying psychological problems are often associated. It could be a form of emotional release in situation of distress or part of attention-seeking behavior. More common in teenage females, feature of dermatitis artifacta. The lesions that are difficult to recognize and do not conform to those known dermatosis bizarre shape with irregular outline in a linear or geometrical pattern, clearly demarcated from surrounding normal skin. It can present as red patches, swelling, blister, denuded areas, crust, cut, burn, and scars. Lesions do not evolve gradually but emerge almost overnight without any prior signs or symptoms. They are usually found on sites that are readily accessible to the patient's hand. Example: face, hands, arms, or legs. Question number 4. A male child born to be a non-consanguineous couple has blisters associated with friction. The couple had a child who had a similar condition and died within a few weeks of birth. What is the condition? A. Neonatal pemphigus, B. Epidermolysis bullosa, C. Congenital syphilis, D. Chronic bullous disease of childhood. इसका आंसर है बी, epidermolysis bullosa. Epidermolysis bullosa, the given clinical scenario with a history of blister at the site of trauma is suggestive of epidermolysis bullosa acquisita. It is a clinically heterogeneous subepidermal blistering disease defined by autoantibodies against type 7 collagen. Clinical characteristics are skin fragility, erosions, blisters, crust, and scars on trauma-prone areas such as hands, knuckles, elbows, knees, and toes. Scarring, alopecia, and nail loss may occur. Both the classic and the inflammatory forms may coexist in the same patient, and the clinical presentation of a given patient may occur. Both the classic and the inflammatory form of may coexist in the same patient, and the clinical presentation of a given EBA patient may change during the disease course. Question number 5. A farmer presents with a swollen foot and multiple sinuses as shown in the below image. What is the most likely diagnosis? A. Mycetoma, B. Sporotrichosis, C. Squamous cell carcinoma, D. Rodent ulcer. Answer A. Mycetoma. Mycetoma, the given clinical scenario is suggestive of mycetoma or Madura mycosis. It is a localized chronic subcutaneous infection occupation, usually in farmers, earliest stage, firm painless nodule, but the time papules and pustules, which break down to form draining sinuses appearing on the skin surface, can extend to underlying bones and joints, giving rise to periostitis, osteomyelitis, and arthritis, and can produce bony deformity discharge. Purulent or seropurulent HPE actinomycosis shows sulfur granules, eosinophilic amorphous material with club-shaped configuration. Treatment dapsone plus streptomycin or rifampicin or radical surgery. Question number 6. A patient who was a known case of chronic plaque psoriasis with more than 50% skin involvement presents to you. Which of the following would you not recommend it? A. Methotrexate, B. NBUVB, C. Oral steroids, D. Cyclosporine. Answer is C. Oral steroids. Oral steroids are not used in the management of chronic plaque psoriasis. Management of psoriasis less than 10% BSA affected topical treatment. Greater than 10% BSA affected phototherapy. Systemic drugs topical treatment. It slows overactive epidermis. Topical corticosteroids vitamin D analogs. Example calcipotriene, coal tar, tozarotene. Topical calcineurin inhibitors tacrolimus. Emollients to avoid dryness. Phototherapy sunlight. UV broadband phototherapy. Artificial light photochemotherapy plus UV excimer laser plus dye laser systemic therapy. Example cyclosporine, methotrexate, acetylation, apremilast, systemic steroid, biological TNF alpha inhibitor like adalimumab, infliximab, etoposide, cytolizumab, golimumab, interleukin 23 agonist, guselkumab, interleukin 23 antagonist, ustekinumab, interleukin 17 antagonist, secukinumab, ixekizumab, interleukin 17 receptor antagonist, brodalumab, CD11A antagonist, ifalizumab. Question number 7. A young male presents to the STD clinic with painful lesion as shown in the image. What is the most likely microscopic finding of the lesion? A. Multinucleated giant cell. B. Punt cells. C. Henderson-Patterson bodies. D. Uh, Halberstadt Provozek bodies. Answer A. Multinucleated giant cells. Multinucleated giant cells, the given clinical scenario with a cluster of vesicles on erythematous base is a suggestive of genital herpes. Tenax finding of herpes shows multinucleated giant cells. Question number 8. What is the probable diagnosis of the condition affecting hair? A. Trichorexis invaginata, B. Trichorexis nodosa, C. Trichothiodystrophy, D. Monolatrix. Answer is C. Trichothiodystrophy. Trichothiodystrophy, the given clinical image showing broken or split hair with alternating light and dark bands called tiger tail banding is of trichothiodystrophy. Question number 9. The gold standard for allergic contact dermatitis: A. Serum IgE, B. Radio allergo sorbent test, C. Patch test, D. Immunoturbidimetry. Answer is C. Patch test. Patch test, gold standard for diagnosis of allergic contact dermatitis is the patch test. Question number 10. Identify the type of lesion: A. Discoid, B. Annular, C. Nummular, D. Targetoid. Answer है B. Annular. The lesion shown here has an erythematous ring with central clearing and is an annular lesion. The lesion shown here has an erythematous ring with central clearing and is an annular lesion. Question number 11. A child presents to OPD with tense bulla over the trunk. A biopsy of the lesion showed a subepidermal level of blistering and neutrophil infiltration at the tips of dermal papillae. Management of this case involves a rituximab, B-dapsone, C cyclosporin, D azathioprine. इसका आंसर है B-dapsone. Dapsone, the given clinical scenario with subepidermal split and papillary tip microabscesses is of dermatitis herpetiformis. For treatment, gluten-free diet and dapsone. Drug of choice is used. Dermatitis herpetiformis, also known as During's disease, is a subepidermal immunobullous disease. Target antigen epidermal transglutaminase 3 and autoantibody IgA associated with gluten-sensitive enteropathy. Characteristics: intensely pruritic, papillovesicular, overextensors and buttocks. Histopathology: subepidermal split papillary tip microabscess, direct immunofluorescence, granular or fibrillar pattern, demands herpetiforms. Direct immunofluorescence demonerating granular IgA deposition in the dermal papillae treatment. Treatment: gluten-free diet. Bro barley, rye, oats, wheat.